Good evening. This is Eric Nelson with AARP South Dakota. Welcome to our second AARP on Tap session this fall. Wonderful fall evening in South Dakota. We're pleased to have you back with us again this week. And if you're joining us for the first time as well, welcome. It's good to have you here. Again, my name is Erik Nelson. I am the Associate State Director for Advocacy for the AARP South Dakota office based here in Sioux Falls. I've been in this position for the last 8 years. And one of my primary responsibilities is to act as your lobbyist out in Pierre during our annual legislative session. Every fall, I go around the state and have some on-tap sessions in different communities, whether it's north, south, east, or western part of South Dakota. And unfortunately, we're not able to do that this year. But when we do gather in person, we usually gather at a local restaurant and share some drinks and appetizers and talk policy and in election year, talk election issues. Well, we're doing that virtually with you here this year, and we're so glad that you took the time to join us. And again, you're participating in our second ARP on Tap session. If you're with us last week, you'll recall that we discussed civics and government with our volunteer state president, Jill Tyler, and Professor Michael Card from University of South Dakota. This week, we are focusing on federal issues, and we are fortunate to have Bill Sweeney with us, our Senior Vice President of Government Affairs, and Erik Gaikowski, our State Director, will be moderating the discussion. I'll do some further introductions in a little bit here. Just a reminder that we still have 2 more on taps after tonight. Next Tuesday, the 13th, we are going to shift from federal issues tonight to state issues next week, and we'll be joined by State Senator Deb Soholt. And then finally, on the 21st, Wednesday, the 21st of October, will be our final AARP on Tap session for the fall. And joining us for that event, which will focus on livable communities, will be Sioux Falls Mayor Paul Tenhaken and Rapid City Mayor Steve Allender. So we think we've got a great slate of on taps scheduled here. We had a great one last week, and we're ready to get going for the one this week. Thanks again for being with us. And to be with us, you had to register. And by registering, you were eligible to receive our giveaway for on taps this year. So if you registered and while supplies last, you received a drink packet in the mail to mix yourself up a cocktail during these on tap sessions. So we're kind of having a drink at the countertop tonight. And you also receive one of these nice AARP, whoops, wrong way, there we go, AARP bottle openers. So if you want a glass of wine this evening, you've got a bottle opener to help you out there. Finally, we're having a sweepstakes that will conclude after all 4 of these sessions. Our sweepstakes includes a cocktail shaker with a bar mat and a $100 Visa gift card for a total value of $145. Now, to be eligible for this sweepstakes, you must attend all 4 sessions and complete a 4-question survey that will be sent out after the final session on October 21st. Once you complete that survey, you will be entered into our drawing, which will happen at 9 o'clock Central Time, 9 a.m. Central Time on October 29th, and the winner will be notified soon thereafter. As you know, we're doing these events virtually, and with technology, we can hear from you via our chat function. Last week, we had a lot of participation in our chat with good questions and good comments for our guests, and we hope that you give us some questions tonight via the chat function. And if we don't get to it tonight, we will follow up with you with the answer the best we can, and we'll make every effort to get to it as best we can tonight. So please utilize the chat function in whatever format you're watching this, and we look forward to hearing from you. And as with last week, we will have the session last for about 40 to 45 minutes max. It's important. We know the weather is beautiful, so we do thank you for taking just a small segment of your day to join us this evening. With that, I'll transition into our discussion tonight. I have a couple introductions to make before I hand it over. First, as your moderator this evening will be Erik Gaikowski, AARP State Director. Erik joined our organization as the state director, in March of 2016, And prior to that, he had been with the American Cancer Society. And then our special guest this evening to talk federal issues with us is Bill Sweeney, our Senior Vice President of Government Affairs for AARP. Bill leads this organization and the advocacy efforts, as well as the state and federal efforts that are executed by the AARP national and state offices. Prior to joining AARP, Bill spent nearly 20 years working in the U.S. Senate and played a key role in passing major legislation, including the ACA, the 2009 economic recovery efforts, and our farm bills. Bill, thanks for joining us. Erik, I'll turn it over to you.
Thank you, Erik. Yeah, good evening, everyone. And thank you for joining us for a fun, interactive conversation with our AARP Senior Vice President of Government Affairs, Bill Sweeney. Bill, I know I mentioned this before, but I hope you grabbed yourself a cocktail before joining us.
I did. Thank you.
Because, our annual AARP on Tap, the events have always been an enjoyable happy hour discussion on current affairs and policy. And for those of you that are watching us virtually, welcome. As I said earlier, we're really looking forward to an interactive discussion. So make sure that you chat with us on our social media platforms. So Bill, I know Erik shared a little bit about you. Anything else that you want to share about yourself, where you're from?
I'm
over a year now, correct?
Yeah, I've been at AARP for just over a year. I'm a child of the Midwest. I grew up in Michigan and spent the last 20 years working for the U.S. Senator from Michigan. And so I'm really pleased and thrilled to be here at AARP for the last year and change. I don't think I knew what I was signing up for. I don't think anybody knew what we were signing up for, but I'm really could not be more thrilled to be at an organization that's doing such good work, especially right now when there's so much uncertainty and so many people are afraid. And frankly, there's so many terrible things happening, especially as it relates to older Americans. And I think being in a place where we can actually advocate and fight for the issues that matter to older Americans, older folks in South Dakota and all over the country is a real honor and a privilege. So I'm thrilled to be here with you and happy to take, let's have a great discussion.
Yeah, that's awesome. And Bill, I know you and I met probably a couple of weeks after you had just started, and the interaction that you had with the state directors from across the country, we knew you were a keeper. So we were happy to have you on board. And, I know it's a little bit drinking from the fire hose, but we definitely appreciate your leadership and looking forward to some good discussion. So, without further ado, maybe talk to us a little bit about, what's happening in Congress right now until Election Day, and then kind of what you foresee happening after Election Day through January.
Well, it's a really good question, and I wish I could tell you the answer. It would be great if I could. If my crystal ball is worn out and no longer working, it's amazing, actually, amazing in all the definitions of that word. That it really does change from day to day. I truly can't tell you what's happening in Congress from day to day because it changes. And as late as Friday evening, we were hearing that that negotiators were really close to coming up with a second COVID stimulus bill. And the news of the weekend, President Trump testing positive for COVID, the sort of a lot of frankly, a lot of chaos happening in the White House and also in Congress. A number of members of the Senate testing positive for COVID. Mitch McConnell then recessed the Senate until late in October, which really makes it hard to imagine how a bill could get passed. And then today, the president tweeted that he wanted the negotiations to stop. I think always from the beginning, I'd kind of gotten a sense as we came out of August, as we were going through September, that it really felt like both parties were kind of going to their corners. The Democrats were pushing, the Democrats in the House passed a bill called the HEROES Act, I guess earlier this summer. The Senate passed or worked on legislation that was a much smaller package. It always felt like they weren't really talking to each other. They weren't really that interested in negotiating, a lot more interested in going to their corners and having something to attack each other with as we get so close to the election. We call it the silly season here in DC, that as we get into closer and closer and closer to the election, everyone gets a little silly. The rhetoric is no longer responsible. Folks aren't talking about, getting things done. They're talking about ways to jab their opponents. And so I think unfortunately you're seeing that play out in a way that is really unfortunate, because there's a whole lot of work that needs to get done. And folks, I know that folks in South Dakota, folks all over the country are really struggling right now. There's a lot of folks who have been impacted by COVID, either financially or health-wise. And I think they look at what's happening on the news and what's happening in Washington, and they probably roll their eyes and shake their head and wonder, who these folks are fighting for. So I hope that people continue to speak out. I hope that you continue to make sure your elected officials hear from you and know that that you expect them to do the work that is on your behalf.
That's great. Thank you, Bill. And honestly, in terms of, after election day, do you honestly see much of anything being accomplished? Back from the elections?
Well, it depends. Again, my crystal ball is broken, but I actually do. I think there's two ways that this election can go. Either there's not a lot of change in terms of who's the president, who is in the power in the Senate. I think all of the prognosticators believe that the Democrats will retain control of the House. So let's take that off the screen for a minute. We're thinking about the presidency and the Senate. If those both remain in Republican control, Trump is reelected and McConnell is still the Senate Majority Leader, I think there will be an effort to very quickly get something done and to show that they're able to govern, that they want to govern. And I think that frankly the House Democrats will be also eager to get something done, to try to get whatever they can get done, get it done. So I do think that there's some hope there. The other issue that we shouldn't forget about is the government needs to be funded. The government's fiscal year ended on September 30th, and they passed what's called a continuing resolution, which, Congress is really good at kicking the can down the road. It kicks the can until December 11th. So they have to pass a funding bill by December 11th, or else the government shuts down. And I think that neither party is eager to see a government shut down. Again, you never know what the news will bring us, but I suspect that no matter what happens after the election, we'll see some kind of progress on some legislation before the new year.
That's a great answer. So, in terms of like AARP policy, what are some of the issues that that we're currently working on that we may potentially see happen in the next couple of months before the new Congress takes over in 2021 and beyond?
Well, it's a great question. We just had a meeting yesterday with my federal lobbying team to talk about what it is we're going to focus on, because we do have this session of Congress, which they call the lame duck. So the lame duck session of Congress is this period of time from Election Day until the new Congress is sworn in on January 3rd of 2021. And keep in mind that the Congress gets sworn in on January 3rd, but the president doesn't get inaugurated until January 21st. So there's a weird period of time in January. So there's lots of fireworks ahead for January, no matter what happens. But in this period between November and January, we're really focused on a couple of key issues, and the issues aren't significantly different than the ones we've been fighting for really all year. I think the first and foremost is nursing homes. All across the country, residents and staff living in nursing homes have been hit harder than anyone else It's jarring and shocking to me when I think about the statistic, which is that fewer than 1% of Americans live in nursing homes, and yet the deaths in nursing homes account for 40% of America's deaths from COVID-19. So this is a real burning problem. It's a real serious issue that we feel very strongly needs to get addressed. And it's horrifying when we look across the country, the number of states where they can't certify that nursing homes have even 1 week of PPE, the masks and the gowns and the gloves that they need. It's really outrageous. And so we're fighting to make sure that nursing homes, that those folks who are most impacted are at the front of the line when it comes to distributing that equipment, making sure that they have testing. The administration has put out a number of proposals and policies. They sent tests, rapid tests to a number of nursing homes. They're working on getting them to everybody. We're going to fight to keep making sure that every nursing home has those tests, that they have the tests that they need to make sure that they're testing the staff, the residents when it's appropriate, visitors, others who are coming in. So that's one issue that we're really focused on. The other is food security. We're hearing from folks all over the country about the real challenges with food and nutrition. And, Congress is focused on this as well. They just passed legislation sort of in the stopgap and that continuing resolution. They increased funding for farmers, and they also increased funding for those who are most in need for food. And they also increased some of the flexibility. So allowing people who are on SNAP which is the food assistance program, they used to call it food stamps, letting folks order online or get curbside delivery of those things so that they can stay safe from the virus. Those are the things that we're sort of focused on, and especially older Americans, people who are living on fixed incomes. We're hearing from people all over the country who are having a real hard time right now. A lot of older folks in my family, and certainly in Michigan and the Midwest, are used to cutting coupons. They know every grocery store to hit on which days to get the best deals. And the stores aren't doing the deals anymore. They're not doing coupons. They're not, the prices have gone up. There's a government study that shows food prices have gone up through the roof since COVID started. So people are really having trouble putting food on the table. So that's going to be another one of our top priorities. And then finally, I think there's a couple of issues percolating on Social Security. I don't want to get too in the weeds, but there's this very complicated formula that Social Security uses around the wages, and we're really concerned that wages have gone down this year, and if that happens, could have a real impact on the future earnings for people who are turning 60 years old this year. So we're really focused on that. We've got our policy wonks digging deep into it to understand exactly how that works. And we're going to be reaching out to folks in Congress to make sure that they're aware of it and thinking about how to fix those issues going forward. So lots on the plate and lots to think about.
Yeah, you honestly stole my thunder a little bit there, because I was going to ask about Social Security and how that was going to kind of be impacted this fall. We worked really hard pre-COVID on prescription drug legislation. How do you see that being impacted by COVID-19, and has that changed our approach nationwide? Any impact on that?
It's interesting. One of the things that happened because of COVID was a lot of state legislatures went out of session early. And so we did have plans all across the country to pass legislation to lower prescription drug prices in state houses. And so some of that is a little bit on hold. We've had some big victories, which has been wonderful. We've continued the work. Certainly the issue of prescription drugs prices has not gone away for older voters, older Americans, especially those who are on Medicare. And as we look at the future of Medicare, I think we might get into this later, but the Medicare Trust Fund is in real dire straits right now because of COVID, because of the high costs that have happened with so many people needing health care, especially older folks who are on Medicare. There's a real strain on the Medicare Trust Fund. And we think about the amount of money that Medicare is paying, your taxpayer dollars are paying for these exorbitant prescription drugs where the prices go up and up and up, faster than inflation, 4 times the rate of inflation. It's just outrageous. And so we're really focused on this. We're going to keep hammering away at it. We have bipartisan legislation in the Senate Again, the election season has made it hard for anybody to do things in a bipartisan way, but we're not going to stop advocating for that and to continue pushing to get folks to do something about prescription drug prices.
I love that response. And honestly, what we hear across the state of South Dakota is our members care about Social Security, Medicare, and prescription drug prices. Those are always the top three. So I appreciate you actually covering all three of those. So outside of those three big issues, what else do you see coming?
Well, look, everything is the pocketbook issues. Those three issues, Medicare, Social Security, and prescription drug prices, those are pocketbook issues. I think the other issue that is out there is, whether there will be a second stimulus. There's a lot of talk that the next package will include another round of stimulus payments. AARP was very engaged in the work to create that first round of stimulus payments. I think Congress should do that. I think it's the right thing to do for the economy. I think we heard the Fed chair today talk about how important that was. I think folks on every side of the aisle agree that we got to do something to jumpstart our economy. And so this is an easy thing that Congress can do to put money in people's pockets right away, especially our AARP members. And so I want to make sure that we are pushing and continuing to push hard for that. And we don't talk about that all the time because everyone else talks about it. And one of the things that we have to do at AARP is think about, if it not for us, if we're not advocating for it, who is? And so we tend to focus on those issues, but those pocketbook issues are still really important to us. And we continue to raise those every day when we talk to members of Congress and their staff, talking about, stimulus is important. Unemployment benefits are important. We've never seen unemployment like this before. So fast, so many people, and in so many different kinds of jobs. And so really pushing hard to get that unemployment relief to folks, as well as, I think looking forward at what comes next and where Congress feels like, as we work to come back from this recovery, where should we be investing? One of the issues that we're really focused on is broadband, right? I think this pandemic, here we are, we're sitting here talking on using broadband. We're using high-speed internet to talk to one another and to stay in touch. And folks all over the country are doing that, staying in touch with their loved ones on Zoom or on FaceTime. And yet many, many people in America, especially in rural places, but also in urban places, don't have access to high-speed internet. Either it's unaffordable or it just doesn't exist. And so I think that, that's going to be a really important issue. And I'd love to hear more about the work you're doing, because I know you're focused on this as well. But we really have to bridge this sort of, folks call it the digital divide, but it really is a big problem. And I think about the work that I used to do, and I was working on agriculture committee issues in the Senate around this issue. The government, the United States government, some number of years ago decided that every house in America deserved to have electricity. And we created this major rural electrification effort. And I think it's time for a rural high-speed internet effort that gets every household in America wired to the internet, so that if we're in another pandemic or some other national emergency where people are needing to work from home, everybody in America has that option.
Well, can I just say that you are 2 for 2? You're batting 1,000 my questions.
I'm sorry. No, I guess my crystal ball is working.
No, it's perfect. No, I was going to actually talk about broadband. That is a policy issue that we're working on in South Dakota. But I guess my question to you is, how do you see broadband legislation, telehealth legislation kind of impacting the work that we're moving forward on the federal level? How does that impact the states? And maybe give folks that are listening out there maybe a little bit of you come from a state office in Michigan. How does that federal legislation impact our state work here in South Dakota in terms of how federal policy impacts state policy?
Well, the way the federal government generally operates when it comes to this kind of thing is they're going to create a grant program that funds states and provides money to states to then do with it what the state, what makes the most sense in the state. And the idea there, right, is that the state of South Dakota knows best, hopefully, who the right people are, who the right contractors are, the right vendors are to provide this service. And having somebody in Washington, D.C. decide what happens in in South Dakota doesn't make a lot of sense. So that'll get delegated down to the state level, and then it will be really important and that's what AARP state offices will do, is we'll then advocate, hopefully, to use that money and to put the pressure on policymakers to make sure that as many people can access that internet service as possible. And so we'll be doing that. We'll roll that out. But that's happening already. There's already grant programs, or already smaller things. And what we're hoping for is a really big nationwide concerted effort to expand broadband. And so if that happens, we'll see a really significant uptick. But even in the interim, there's a lot of work that needs to get done to make sure that policymakers understand that this is something that should be on the list. Budgets are choices. When people put together their state budgets, they make choices about what's important and what's not important. And it's so important. I think it's so important, especially, it's 2020. And, even as we're advocating, you're talking about telehealth, trying to get virtual visitation in nursing homes in some states, it's been a real nightmare. The nursing homes say, oh, we don't have the technology, we don't have the internet, we don't have an internet connection that's fast enough. And they say, really, it's 2020 and we don't have an internet access, we don't have internet, we can't get an iPad so that folks can talk to their mom or to their wife or their husband in a nursing home. It's just, it's a little crazy to me. So I think we have to keep fighting and to keep making sure that everybody has access to that really important. I just think, today's day and age, this is as basic of a service as electricity or water. I know a lot of folks don't have water service either. So it's a real thing that we really have to get connected to folks' homes.
Yeah, I really appreciate that answer. And from the state perspective, I was extremely happy that my predecessor, Sarah Jennings, and Eric Nelson took up the cause of making sure that our telehealth legislation was in line to be able to offer those telehealth services. So now just expanding that broadband service across the state really can boost those telehealth services to people that may not have had access to it earlier. So I agree 100%. It's incredible. It's 2020 and there's so many spots across South Dakota that don't have quality broadband coverage that could make their daily lives so much easier. So appreciate your comments on that.
No, and telehealth, I think, is one of the real. I don't know that there's such a thing as a bright spot in a global pandemic that is horrible, but telehealth really feels like it is a bit of a bright spot. It's having a moment. And what's neat about this moment is that people are finally trying it out. I think a lot of doctors were resistant. I think a lot of patients were resistant. This morning, I actually had a telehealth visit with my doctor. My annual checkup, we did it on Zoom. And so, strange new world that we live in, but it was amazing, right? I didn't have to leave my house. My doctor didn't have to leave her house. And it was super convenient. And, obviously it's not going to work for every kind of doctor's visit, but for the ones where you're just checking up or renewing prescriptions or, just doing a quick check-in, it's a great option for folks. And so hopefully we'll see more people using it, even after this pandemic is over.
Yeah, I agree 100%. And, when you think of the distances that folks have to travel in South Dakota from some spots, you're driving 3 hours at 80 miles an hour just to get to a hospital. It's definitely a lifesaver for so many individuals. So I guess back to the November 3rd election, it's coming up less than a month away. Can you talk a little bit about AARP's voter engagement efforts this year from the national level?
Well, yeah, I think this year it's called Protect Voters 50 Plus, and I think the key issue that we're focused on in terms of voter engagement this year is, first of all, making sure that voters 50 plus can vote safely, that they have the information they need to know how to vote, whether they want to vote in person or vote early by mail or however it works in every state. Each and every state has their own rules about how elections work. And I'm glad that the Chiron is there so you can go to the website and find out exactly what's going on in South Dakota. AARP put together these websites for each state, and as well as the October edition of the Bulletin will include information about how to vote safely in every single state. And so There's real local and specific guides for folks. It can be a little bit confusing. I live in Washington, D.C., and where I live, everybody gets mailed a ballot. And I just got mine the other day. I haven't decided what I'm going to do. I know I'm going to vote for president, but down the ballot for city council races, I still have to do some research. So, that's how it works in DC, but it's different in every state. And we know from our surveys that about half of AARP members want to vote in person this year, and about half of them want to vote by mail. And so we're making sure that people have the information they need to do it safely and to do it the way that they want. In addition, we're working to make sure that our members are asking questions about the issues that matter the most, and we're making sure that candidates are talking about the issues that matter to the voters who are 50 plus. And that means Social Security. There's been a lot of debate about Social Security already this year. I think it's going to continue to be one of the most important issues for folks going forward. Medicare, Medicaid, healthcare. Healthcare is definitely on the ballot this year, and there's lots of different proposals out there that folks need to weigh and really think about, as well as those pocketbook issues. And so, thinking about all of those things and how it really matters to people, has been a major priority for us. But then we'll also talk about our work all around the country in state houses to fight to make sure that voting is safe, that folks can vote safely and reliably without a lot of hoops to jump through and a lot of hassle. And so in some states, the voting processes are very smooth and easy, and they work very well. In other states, sometimes voters have to jump through a lot of hoops to vote absentee or to vote remotely. And so we're fighting to bring down some of those barriers to make it easier for people. I think in America, voting should be safe and secure, but it should not be something that is challenging or like the most difficult thing you do. You shouldn't have to read a book to figure out how to do it. Voting is an easy thing. We've been doing it for hundreds of years in this country. I think we can figure it out and make it easier for folks to get in and vote.
That's a great response. Fortunately in South Dakota, we are part of what we're working on for our voter engagement campaign is really about making sure that folks are utilizing our no excuse needed absentee ballot request. So I think there's a real strong opportunity for folks to get out ahead of time and vote without having to wait in line or get out to the polls on November 3rd. Just make sure folks are staying safe at home and utilizing that effort. But I know Erik Nelson, our advocacy director, is looking at legislation in 2021 to expand more voting opportunities as well. So you're absolutely right. Federal, state level, we're all AARP's all in on making sure that it's safe, secure, and expanding the opportunity for more people to vote.
Yeah. So, and look, I'm glad we didn't have to do this, but in some states we've had to go to court, and we've won in those court cases. And just next door in Minnesota, we won some really groundbreaking lawsuits to make it easier to vote, to take down some of those barriers. In some states they make people get notary. A notary has to come and notarize their ballot before. And you're thinking about this in a pandemic, and people have to, where are you going to find a notary, on a Saturday afternoon? And so it's kind of a nutty process, and it just makes it harder for folks to have their voices be heard. So we're fighting, whether it's in the state houses or in Congress or in the courts, to make it so that people can vote safely. That's great. So what other things can people do to participate in our voter engagement campaign? Well, look, I think that the members, AARP members, should get involved. There's a lot of work that can be done. I think the link is there, aarp.org/election 2020, where you can get involved in our voter education campaign. I think the most important thing is asking questions. People who want you to vote for them, people who are asking you for your vote, which is a precious thing, are obligated to answer your questions and to tell you where they stand on the issues that matter. And so don't be shy, ask those questions, put people on the spot, make them answer the question if they dodge around it. make them tell you where they stand on the issues that matter to you so that you can make an informed choice, and frankly, so that you can hold your elected officials accountable to make sure that they do the things that they promise that they're going to do.
Well, we definitely appreciate people being involved in the process all the way through the election, but also advocating at the state legislature, at their city halls, or in Congress. So definitely appreciate that. As
I can tell you, Eric, it makes a huge difference. If I can just jump in, the question that I get all the time that people are, does it matter if I call my senator? Does my senator really care that I called them? And I can tell you, having worked on Capitol Hill for 20 years, they absolutely do, especially in a state like South Dakota, where people know each other. But in every state, even big states, in California, the folks who answer the phones in the California senators' offices, they're recording everybody who calls. They're keeping track of that. Certainly in smaller states, it's even more the case. It absolutely makes a difference. And, there's nothing wrong with being the squeaky wheel that gets the grease. And so if you are frustrated or upset about something, you should absolutely feel confident calling your member of Congress, calling your senator, and demanding that they do something about it.
I could not agree more, especially as you said, in a small state like South Dakota. It definitely takes a few calls to swing somebody's mind that they haven't made up for themselves. Yeah. So definitely. So, as I'm saying, as we kind of wrap up, are there questions that I didn't ask you that you think that the South Dakotans, AARP South Dakota members, should know in terms of AARP's just federal legislation, policies, things coming down the line that we may have of interest?
Well, I think there's a couple of issues, and I will just mention I think one of the big issues and one of the areas where we've been thinking about our prescription drug campaign, is on what happens with a vaccine. And I think one of the things that we're hearing from the administration as they look at developing treatments, there may be more than one. I don't think that we're going to have a vaccine, right? That we think about other vaccines like the measles or shingles or something. I think there's going to be perhaps a host of vaccines, several vaccines. And I think that as we think about those vaccines, we're going to need to make sure that they're, first of all, effective, safe, and affordable, right? It's not, a vaccine doesn't matter if it's not affordable. And so we're going to be fighting to make sure that happens. But also, I think, making sure that they're safe and effective. And we know that there's a rush to get a vaccine. And I think almost all of us would agree that's a good thing, that we're putting all of our energy into finding a vaccine to this virus that's caused so much disruption. But we really need to make sure that we're not cutting corners when it comes to safety, so that people can feel confident that when they take the vaccine, they're taking a vaccine that is going to make them keep them healthy. And so we're going to continue our advocacy and our lobbying to make sure that is the case.
Yeah, I agree 100%. And honestly, it's a case of making sure it's safe, but it's also cost effective too, or cost affordable.
Right. Yeah. I mean, look at, as we say about prescription drugs, if you can't afford it, it doesn't matter, right? You can't, the drug doesn't work if you can't afford to take it. And what's shocking to me, we did a study right before the pandemic started, that 33% of people in America stopped taking the drugs that their doctors had prescribed for them because they couldn't afford the prescriptions, which is just outrageous. It's 1 in 3 people. I don't know what the numbers were in South Dakota, but that's the number nationwide. And if you think about, if that were the case with the COVID vaccine, where only 3 out of 10 people couldn't afford it, I think we'd have a real challenge on our hands. So we're definitely fighting really hard to make sure that those are affordable, but also that they don't put a tremendous strain on government programs and on taxpayer dollars, right? So taxpayer dollars are funding the research into these vaccines. Taxpayers shouldn't then also be gouged at the end of the day when the vaccine comes, and then Medicare or Medicaid has to pay for these things.
I would say 110,000 AARP South Dakota members would agree with you. We actually have a question in chat from YouTube, actually. So back to our original question we just had a couple of questions ago in terms of, does it make a difference if I call the DC office or the local office for the U.S. senators in South Dakota or representative?
Well, I would say it depends on what you're calling about, is the first thing. But I would also say, I think in this time of COVID right now, it doesn't really matter at all. So I think whatever number you can get through to the fastest makes the most sense. Usually in almost every state, in the state offices, so in the South Dakota offices for your senator, those are the folks who are going to help you with specific kinds of what we on the Capitol Hill call casework. So if you're having a specific problem that, let's say you didn't receive your Social Security check, or there's a problem with your Medicare account, or some other kind of problem that you're having with the government, where you are specifically needing somebody to help you figure it out and navigate the bureaucracy. Usually the state office is the right person to call because they can help you. Whereas if you have an issue, want to express your viewpoints on federal legislation that's moving through Congress, then the DC office is the most effective place. But now that everybody's working from home, when I talk to my colleagues on the Hill, they're all over the place. They're the folks who used to be the legislative staff in Washington are now back home in South Dakota or Minnesota or Wisconsin or wherever they are, and so it doesn't really matter as much at the moment. I think anybody you can reach out to will take the message, and they're all they share this stuff in real time. I can tell you, as a chief of staff in a Senate office, the number of emails you'd get a day where I just got a phone call from a constituent who's angry about X. What do I say? Those things happen, and people really do pay a lot of attention to the concerns that their constituents raise.
100%. We always say we want to hear from the real people.
That's right.
The real voters, the real residents of the state. Well, Bill, we're at time here, but I just can't thank you enough for joining us. It's been an amazing conversation, and I appreciate you so much. And the state of South Dakota appreciates you, and the AARP organization appreciates you. So,
well, thanks so much, Erik. It's been great to be with you, and I appreciate the great work you and everybody in South Dakota is doing. And so, thank you to our advocates and our volunteers all across the state who are helping to make a huge difference right now.
Well, we're going to do our darndest to get you out to South Dakota in the near future. So,
will do. I'll look forward to it.
Awesome. Thank you so much. And I know Erik Nelson is going to come back and say a few final words.
Thank you, Gaikowski, and thanks again, Bill, for joining this evening. You guys have earned the opportunity to finish off your beverages, and as we celebrate our second on tap here, and Bill, we appreciate you taking the time to be with us. I hope everyone had learned a lot. I know I did. It's always informative to kind of get the perspective of what's happening in DC from someone that's out there within our organization. And Bill, you definitely brought some good, valuable information for us about what's happening now, what's going to be happening in the future, and election related as well. So thanks again. As we leave this evening, I'll remind you one last time that this was our second of 4 on taps. Our next on tap virtual event is next Tuesday, October 6th at 6:30 Central Time, 5:30 Mountain Time. And if you've been to the first 2, you might as well finish it out and hit 3 and 4, because like I said, you'll be have the opportunity to register for sweepstakes after the 4th on tap event. And beyond that, we got some good comments and questions again tonight. Thank you very much. And we encourage you to come next week ready to ask some questions. Like I said, we'll be transitioning to state advocacy and state government and issues in our state legislature. Joining us will be State Senator Deb Soholt. Deb Soholt is based out of Sioux Falls and has been in the state Senate for the last 8 years. She is term limited and is not on the ballot here in the November election, so she will be leaving the state Senate. So she'll be able to give us a recap of her time out there and talk about what she's hearing from her constituents, issues that she's worked on, and kind of what she thinks is going to happen out in Pierre through her own lens as a soon-to-be retired state legislator. So we look forward to bringing you that event next week. Thanks again for joining us, and we'll see you next Tuesday. Take care.